Hi everyone, it's Dr. Ansari. I'm going to be talking to you about treatments for recurrent urinary tract infections. Click on that box, the I box that shows up on the top of the screen to connect with the prior video that goes over the definition and criteria of recurrent urinary tract infections that has to be met in order for you to qualify to have that diagnosis. And then, it just helps the doctor decide what treatments to use, and that's where we're going to be talking about today. So first off, there are over-the-counter medications that are available, like D-mannose, cranberry pills or extracts, and probiotics. Okay, now first of all, cranberry pills or extracts is better than taking juice because juice has a high sugar content. So there are pills available for cranberry extract. Now, I'm putting all of these together in one box because they're all over the counter and available, but they have not been shown to be effective, or at least the research shows that it's inconclusive in terms of how effective it is in preventing urinary tract infections. The downside is that it just costs money. Otherwise, there's very little harm in trying these medications. If it works for you, great. Then continue using this because it's accessible and it's simple. But if it doesn't work for you after, a few months of trying it, then definitely probably need to move on. In patients who are perimenopausal or postmenopausal, vaginal estrogen is going to be a therapy that is frequently prescribed and is the number one prevention for your recurrent urinary tract infections in this particular population of perimenopause and postmenopause. And that's because a decline in estrogen can lead to increase in urinary tract infections because the vagina that typically, and the urethra itself, both of these are estrogen dependent organs, meaning they rely on estrogen in order to function. When you don't have enough estrogen anymore, the ability of the vagina and the urethra to protect itself from infections also goes down, and so you get more infections. So reintroducing vaginal estrogen to the vagina is going to be an important method of preventing urinary tract infections moving forward. Vaginal estrogen does have a good safety record. Unlike the black box warning that you see, the FDA requires vaginal estrogen to carry the black box warning because of estrogens in general being associated with other complications. However, vaginal estrogen, when prescribed appropriately, does not enter the bloodstream at very high levels, and so is safe to use long term. So typically it just kind of stays in the vagina. Another therapy that I frequently like using is something called methenamine that we pair up with vitamin C. And what it does is it creates something called formaldehyde. Sorry, squeezing in there. There's an E at the end. Formaldehyde. This is something called a bacteriostatic agent. So it's not an antibiotic that kills bacteria, it just prevents bacteria from growing. Bacteriostatic agent prevents it from growing. It makes it still, which is what the word static means, to make still. This definitely has to be done under the supervision of a physician because there are certain patients who cannot use methenamine, and those are patients who have kidney problems. So there are often doctors do some kidney tests at certain intervals, and then also give patients breaks after certain intervals of treatment to give their kidneys a break. The next treatment is going to be antibiotics. Antibiotics are the most effective in preventing urinary tract infections. However, it's not the first method that we use to prevent urinary tract infections because of the downsides. The downsides are side effects and resistance rates. Resistance means that the bacteria stops responding to that one antibiotic, and now you can't use that antibiotic anymore to treat an infection. There are different ways of using antibiotics for patients, and it really depends on how your infection gets started. In some patients, they get infections after having sex. So this is called postcoital prophylaxis. So we'll tell you to take an antibiotic right before or after sex. Other times, once we've reliably been able to pair up your symptoms with positive cultures, then we could potentially do self-start where we just have a standing order of antibiotic for you, or you have a bottle ready to go, and when you feel the symptoms, because we know they've been paired with positive cultures in the past, then you just start the antibiotic on your own to treat, so self-treatment. Another method is of suppression, or preventing the urinary tract infections from happening, is taking one pill daily for 6 months. After that point, we usually stop and see if you get your infections again, and if you do, then you get back on it for a longer period of time. The ideal situation is to try to decrease the amount of exposure you have to antibiotics. So often we try the other methods I talked about before we go to antibiotic suppression methods. All right, thanks for watching.